Well, good afternoon. I'm Dr. Lisa Schulman, and I'm a movement disorder specialist, director of the Parkinson's Disease and Movement Disorder Center at the University of Maryland. And I'm a former board member of the American Brain Foundation. And it's a pleasure to be with you this afternoon to talk with you about the links between Parkinson's disease and the COVID-19 pandemic. So, the most obvious question that someone might wonder about is whether Parkinson's disease increases the risk of getting the coronavirus. And fortunately, Parkinson's disease doesn't increase the likelihood of uh, getting the infection of the coronavirus. And there really should be very little confusion between Parkinson's symptoms, which, as you know, are things like bradykinesia or tremor, in other words, slowness or tremor. And that should rarely be confused, if at all, with the symptoms of COVID-19 or the coronavirus infection. Even though it's true that there's no reason to confuse the two, because, of course, the coronavirus, the main symptoms that you should be aware of the coronavirus is fever, cough, shortness of breath, and these have little overlap at all with the symptoms of Parkinson's disease. But there are a number of secondary considerations that I want to bring to your attention about the associations possibly between Parkinson's disease and the pandemic. So, and the first one is that people with Parkinson's disease may be more vulnerable to infection in general. And that would be related to possibly age itself, because as you know, age over 60 is considered a vulnerable population, and just general frailty. In other words, people who have either advanced Parkinson's disease, are older, or have multiple medical conditions may have become more frail over time and more vulnerable to illness. It's also true that if one does get the coronavirus, and of course, most of us, or many of us, I should say, many of us are going to get the coronavirus over time. And, most infections tend to cause Parkinson's symptoms to worsen. If you have a urinary tract infection, a common urinary tract infection, or a common flu, or a simple cough, all sorts of different kinds of other illnesses have a tendency to worsen one's Parkinson's disease. One thing I've heard a lot from my patients is people may call up and say, I don't understand it. I'm taking my medicine just as I always do, but the medicine isn't having as good an effect. And one of the first things I always ask is, do you have any signs of any other medical condition right now? And sometimes they find that they, sometimes even without their awareness, they've developed a urinary tract infection, a UTI, and when that's treated, the problem with their medicine being as effective has improved completely. So that would be an example of a link potentially between COVID-19 and Parkinson's disease. But there really are many other secondary risks and stressors that I want to review with you. One is that, uh, as I think all of you know, activity, whether you're talking about physical activity or cognitive activity or social activity, are all vital components to delay Parkinson's related disability. They're really vital parts of uh, maintaining and taking a good care of yourself. But all of those become more difficult now during the pandemic because the pandemic is fostering quite a bit of isolation and considerable stress. So, one of the things to think about, and I think we're all really quite aware of this these days, is that the pandemic is associated for everybody with increased stress and increased anxiety and more isolation. So there are mental health consequences that are bound to increase the some of the mental health issues that have already or pre-existing in Parkinson's disease itself, like anxiety. Anxiety is a common problem amongst our patients. Another issue is the social distancing involved that we're all being asked to participate in. And of course, that will result in further disruptions in social interaction and cognitive engagement. And one of the things that I've done over the course of my research career is study exercise as an intervention in Parkinson's disease. And so I'm very aware of the importance of physical activity and exercise to delay disability. But it is also true that cognitive activity and social activity, social interaction, also have an impact overall on the general health and may ultimately be also found to delay Parkinson's related disability. So something more tangible and more concrete that we're all adjusting to is the use of protective equipment, such as a mask and gloves. And here there are some interesting overlaps with some of the Parkinson's uh, symptoms. For example, for all of us, every one of us have had an experience now of using mask and gloves as protective equipment during the coronavirus pandemic. And you don't have to have Parkinson's to realize that using mask and gloves is awkward and cumbersome. But I believe that masks will be even more difficult for people with Parkinson's disease. For example, people who have speech disorders, such as low volume of speech or slurred speech, and are harder to understand. It certainly isn't going to be helpful to have a mask on. This will be a further barrier to communication. Another example is the symptom of drooling, which not all, but some Parkinson's patients experience. Obviously, wearing a mask, if you have a problem with drooling, or some Parkinson's patients have a tendency for more to just have a runny nose, and that will be obviously an added problem when wearing a mask. Another thing that maybe we've all noticed now is that when you're wearing a mask and trying to go about your day or going to a store, that a mask oftentimes can obscure vision to some extent because it tends to sort of ride up on your face and get a little tangled with your eyeglasses. And when that happens, your vision is not quite as good, and that could be a aggravating factor in terms of our mobility, walking or balance, and the risk of falls. So all of these things are good tips to think about because there's increased risk related to using this protective equipment. How about gloves? Well, gloves can aggravate problems with dexterity of the hands, of course. And for example, in more specifics, may interfere with the use of an assistive device, such as a cane or a walker. But also all the other things we do with our hands that require dexterity if you're out of the house and using gloves. All these things are something to keep in mind. Well, another topic that I want to touch on is how the basic routines of healthcare are being impacted by the pandemic. And things that have just been complete routine parts of daily life, such as visiting your neurologist, continuing physical therapy, refilling prescriptions, all of those have become more difficult and likely are requiring some changes in your habits, such as that maybe if you went to the pharmacy, now you are looking for a pharmacy perhaps that might deliver, if possible. As far as therapy goes, it's really not safe to go to a rehabilitation facility or to have a physical therapist or other rehab therapists come into your home during social distancing. So these things need to be delayed. There are other obstacles or interruptions in healthcare and Parkinson's disease that I've encountered with my own patients, and you may encounter. Some people with Parkinson's disease have various forms of muscle spasms, oftentimes called dystonia, and receive botulinum toxin injections. Botox is also used for drooling. And in most cases, Botox injections are not being done routinely right now, so that is something that may also be delayed. Elective surgery has been restricted, in some places completely suspended, and that has resulted in some of our patients at the University of Maryland having to make special arrangements to have their deep brain stimulation battery replaced, and some scheduled DBS procedures have been delayed now because of the pandemic. Another thing is that uh, the routine that one might use for urgent care, such as going to the emergency department, is now something that one has to think twice about because of the increased risks resulting from the coronavirus at our hospitals. Other things in this category would include the routine use of home health aides, uh, housekeeping, all the people that come through our homes. One has to weigh the risks compared to the benefits. So I mentioned before my own interest in research in physical activity and exercise. And right now, we're all in a situation where that tends to promote more sedentary habits. And because there's less access overall to fitness equipment, to going to a health club, to have a personal trainer for some people. And as I said before, for rehabilitation. So for all these reasons, exercise and activity are going to be compromised. And it's concerning because there is very, very strong evidence now to demonstrate how important exercise and activity is in delaying disability in Parkinson's. So a last secondary consideration that I want to raise is that a variety of facilities or institutions like senior residences, assisted living facilities, and especially nursing homes, all of these settings are more vulnerable to coronavirus spread. So I'm sure that if you are living in these kinds of facilities, that you are hearing quite a bit about the precautions that need to be taken. So up to this point, I have been talking about the very many ways that you can see that there are associations between the experience of this pandemic and being a Parkinson's patient. So I'm going to speak a little bit more about how to respond to these obstacles, and then there'll be a little bit of time for you also to hopefully write in your questions. So, I think that responding to all the changes and obstacles that we're all confronting requires a lot of creativity, being really proactive, and also learning from one another. And so when I finish this talk in just a few minutes now, I hope that those of you who are listening today will share your own strategies. What have you learned and what have you tried that's working for you to reduce stress, to manage your health needs, and to remain active? So you can mull it over a little bit while I make my final comments. So, in terms of being proactive and finding ways to manage these new challenges, I think that one thing that's become very apparent is it's all the more important than ever to become familiar with online communications and telemedicine. So, for those people who are still not comfortable or haven't even gotten started with the use of online communications, this is a great time to spend time to get over the hump and be able to do that. We're finding as we're contacting patients for telemedicine visits that I'd say only about half of our patients seem to be fully comfortable with them. So obviously, there's still a lot of people who need to be able to use a platform and connect with their healthcare professionals. Another thing is that you can use the same sorts of modalities to sustain your social contacts. There's also been a lot of creativity surrounding opportunities for virtual activities, such as virtual rehabilitation therapy and streaming exercise and streaming yoga. Many of these different opportunities existed before, but are really being reinforced and expanding because of the pandemic. So, actually, and I mean, another thing to think about being proactive is after being home for so many weeks for some of us, one might look for what is the silver lining during these challenging times. And I think that there is a silver lining in that the slower pace that's being enforced on us is actually an opportunity to do things that we always say we never can find time to get to. So everyone can sort of think for themselves about what are their individual projects they never get to. Maybe some things like home projects like organizing photos. I almost don't know anybody who really has organized their photos well. Reading books that we always said we would get to, or cooking comfort foods at home. So these are all ideas. I hope that, and I'm sure you have better ideas than I do about how to overcome these hurdles. So I'll summarize with these last comments, which are that, just to summarize my previous points, the disease process of Parkinson's disease is not likely to pose special risks for COVID-19 infection, but there are a number of secondary risks that I reviewed with you. The stress and social isolation with limited opportunities for physical, cognitive, and social activity, I believe is a special threat that is significant and may even aggravate Parkinson's symptoms and hasten disability. And that may be a strong statement, but I believe that activity, all types of activity, are so important for our patients that a long stretch like this of limited activity can be detrimental. So maybe the hardest part is that we're still in a period of uncertainty about when we'll ever be back to normal times. And this really underscores the importance of all of us finding new strategies to remain active and delay disability. So with that, I'm going to conclude. Thank you so much for taking the time to come today and listen.